Coming of Age is coming up next. I'm your host, Emily Echeverria. Today we're talking with orthopedic surgeon Dr. Travis Roth about a common cause of shoulder discomfort, rotator cuff disorders. Next up, we'll be speaking with the executive director of Independence for the Blind about the resources, training, and support they offer to those with visual impairment. Lastly, we've got advice to prevent slips and falls in the home from Solaris Healthcare. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Rotator cuff disorders are one of the most common causes of shoulder pain. These types of injuries are common and increase with age. Here today to talk to us about how to know if it is time to see your doctor and what type of treatment options are available is Dr. Travis Roth, an orthopedic surgeon at the Andrews Institute. Thank you for being here, Dr. Roth.
Thank you.
So what is rotator cuff disorder?
So rotator cuff disorders may be acute or chronic conditions, and it's a very common cause of shoulder pain in individuals that sometimes manifest as limited range of motion. Sometimes it's pain at night. Sometimes it's pain with activities of daily living. You may or may not have noticed that you had an injury because a lot of times it's actually a wear and tear condition.
And what are some of the most common ways someone may injure their rotator cuff?
So that's the thing. It's not always an injury. A lot of times it is wear and tear over time. So I tell my patients the rotator cuff are these tendons that let you elevate the arm, they let you rotate the arm, they help keep the ball in the socket. And you can imagine that if the rope is abraded and it becomes sort of a partially torn rope, then that's a partial rotator cuff tear. And if it's completely torn, then that's a full thickness rotator cuff tear. That process often happens in a degenerative fashion over time. And so the vast majority of tears that we see are actually chronic tears, although there is a subset of individuals who have a very discrete injury in which they fall or they dislocate their shoulder, and that can also lead to a rotator cuff tear.
How does someone know when it's time to come see you and talk about it versus giving it a little time and letting it heal on its own?
Yeah, it's a good question. I think that, shoulder pain is of course common, but if it persists for several weeks and doesn't seem to respond to taking anti-inflammatory type medications like Advil or Aleve or doing gentle exercises, that may be a worrisome sign that you should be seen by a shoulder specialist, as well as having weakness of the arm, difficulty raising your arm or holding objects out in space. Those kind of things are signs that you should probably have your shoulder evaluated.
Are there multiple ways to treat a rotator cuff disorder, or is surgery almost always the answer?
No, there's definitely non-surgical and surgical treatment options, and it really there's such a broad spectrum of rotator cuff tears that some of those partial tears that we spoke about earlier, some of those are better treated non-surgically, at least initially, and that can be with physical therapy, anti-inflammatory medications, and various injections. Some of the more complete tears are the ones that are definitely torn to a high degree. Those may be more amenable to surgical management with a good outcome.
What is the prep work for a patient that decides to get this procedure?
So it usually starts with a clinical evaluation to assess range of motion, to assess strength, and then we need radiographs. So that includes both X-rays and an MRI. The MRI is particularly important to help characterize the tear in terms of size, the extent of it, the extent of how old the tear is. All these are factors that help us determine the best way to treat the rotator cuff tear.
Are there factors that would prohibit someone from being a good candidate for this procedure?
Not necessarily prohibit the procedure, but there are some factors that definitely can negatively affect the outcome of a rotator cuff surgery, namely smoking and uncontrolled diabetes. Those are things that we counsel our patients to either quit smoking or help control their diabetes prior to surgery in order to optimize their outcome and have the best possible recovery from a rotator cuff surgery.
When someone has this procedure, what does the day of surgery look like?
Day of surgery is actually fairly easy for the patient. It is an outpatient procedure, meaning you do come and go the same day. It's done minimally invasive. We use an arthroscope and very small incisions to do it. This procedure itself often lasts about an hour to repair the rotator cuff. The patient is also given a nerve block. So we have some excellent anesthesiologists that can provide what's called a peripheral nerve block. So you really don't feel much of your shoulder the day of surgery and for several days after. So it's incredible pain relief. And then I have people start physical therapy within a few days of surgery. I think that early mobilization afterwards helps improve their outcomes in terms of restoring range of motion and strength.
And what can a patient expect during recovery after surgery?
So they should expect that their arm is typically immobilized in a sling for about 4 to 6 weeks, depending on the size and the chronicity of the tear or how long it's been there. And then of course they start physical therapy fairly soon, within a few days. They're doing physical therapy 2 to 3 times a week for about 8 weeks before they transition to what's called a home exercise program. So you're looking at a full recovery a lot of times, 4 to 6 months in terms of regaining all of your strength back in the shoulder. And I tell people, and that sounds like a long time, and it's because the rotator cuff itself is a tissue that doesn't like to heal on its own. So when we make it heal, it takes a bit of time. Although the outcomes are very good, and people are often able to return to their lives and have normal activities.
When can a patient expect to be finished with rehab and recovery?
Yeah, as we were stating earlier, so I think that a lot of times it varies depending on the how old the tear is, how big the tear is, and how much and how hard it is to fix. So some of those things play into this, but typically speaking, people are obtaining full range of motion of their shoulder again after about 6 to 8 weeks. They're starting to work on some strengthening of the shoulder around 2 months, and then a full recovery around 4 to 6 months. So some of my individuals who are, say, golfers, I'll have them start chipping and putting around 3 months out from surgery, and then they're taking full swings 4 to 5 months after surgery.
And what's the best way for a potential patient to reach out if they want to come see you?
Patients can reach out to us online at injuresinstitute.com or to call us directly at 850-916-8700.
Next up, we're talking to Raven Holloway, Executive Director of Independence for the Blind, about what this organization offers our community.
If you're looking for a fun and exciting environment for your loved one, then L&L Executive Adult Daycare is a perfect fit. We offer social gatherings, physical activities, games, outings, and daily luncheons from Karen's Catering. We take a holistic approach to social stimulation and aim to enrich the lives of our guests. Let us help restore your loved one's mind, body, and soul. We'd love to speak to you. L&L Executive Adult Daycare. Big business love with small town feel.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere, and just growing up the way I grew up and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
Independence for the Blind of West Florida has been in the community for more than 40 years, serving its mission to empower people who are blind or visually impaired in Northwest Florida to achieve maximum independence. They have grown to serve 10 counties in Northwest Florida through training and other support. We've got Executive Director Raven Holloway here to tell us more about this organization's work. Thank you so much for being here, Raven.
Oh, absolutely. It's great to see you, Emily.
Yeah, you as well. So tell me about the mission of Independence for the Blind and what you offer the community.
Absolutely. We share our goal is to empower people that are blind and visually impaired to become as independent as possible for that individual. Whether that means we are teaching them how to cook and clean and take care of themselves, do their own laundry, wear matching clothes, get their shoes right, how to shave. It's the amount of things that you don't realize that you use your vision for. And so we do that, but we also have clients who have mastered those things but are interested in being in the workforce. And so we work with them on helping them find jobs, getting the training that they need to be able to have to attain them and maintain them.
Hmm. So I understand you have different training programs for different age levels and for various situations. So what are the programs that you offer?
So we start with ages 5 to end of life, and so we have our children's program, which all of our children were actually born with a degenerative disease, or we have one little boy that was born without eyes, and so their training, they've been in this training since they were born. So we work with them, we help them learn how to self-advocate for themselves, be able to share who they are, what their disability is, and what they need to succeed in life. When we go into the teenagers, we work with them on getting them into college or into a trade school or into the workforce, depending on what is best for them. And then we transition into like our adults, and like I mentioned already, we work with them on household skills, taking care of yourself, how to get a job. And then some of I would say probably our hardest for our clients, the hardest ones, I think the ones that feel like their experience is the hardest is when they've had vision their entire life and lose it due to an accident or stroke or diabetes. And that is where they require a lot more training because they've never had to learn how to live without vision.
Sure. What are some of the biggest challenges that blind and visually impaired individuals are facing in our community?
In our community, I would say transportation is the biggest problem, and those that choose to like live closer to where they work and things they do, we don't have any audible sidewalks, and so that is something that is been in discussion with the city about is getting audible sidewalks because it's not safe for them to be out.
So what do you mean by audible sidewalks?
Oh, I'm sorry. Audible sidewalks are, you know how you go out here to the corner and it has like the walking guy or the stop hand. It's like that, but it makes noises that tells you that you can walk or can't walk.
Gotcha.
Because they can't see the light, so it would audibly tell them when they can and cannot go.
Gotcha. Yeah, transportation is a big issue for seniors as well. So that's something we always look at with our agency. So you mentioned people that have had sight their whole life and then lose it due to an injury or a disease. So if a person is starting to lose their eyesight as they age and they might feel like they need the resources to assist them from your agency, what is the process of getting that support?
Reach out to us immediately. The sooner the better. It's easier to help you while you're losing your vision than for you to completely lose it, because we can help you train better that way. I mean, obviously we can work with everyone, but to make it easier on the client, that's how we do that. But there is an application process on the Division of Blind Services website. And if you don't use computers, because sometimes we deal with that with the elderly, just call us. Just pick up the phone. We will fill out the application for you. We will get you processed through it. All of our services are completely free. And all you have to do is live in one of the 10 counties we serve in Florida. And
what's that number?
Our number is 850-477-2663.
Gotcha. So tell me about White Cane Day that you have coming up and what you'll be doing for that.
White Cane Day, we also hold our annual meeting that day, which is open to the public. We will be doing wine and cheese. It's the 12th, Wednesday the 12th. And we invite anyone who would like to come out and learn about who we are and what we do. come on out. We'll gladly provide hors d'oeuvres and wine, and it's a Saturday evening. Why not? And we'll have clients out there. You can meet them. You can tour our facility, and really be able to see what we do day to day.
Sure. Awesome. So how can people get involved with your organization if they want to volunteer or support in other ways?
I am so glad you asked that. Please call me. The number again is 850-477-2663. We are in desperate need of volunteers, as most nonprofits are right now. But yes, if you are interested in helping, you don't have to know how to do anything. Being someone's eyes to help them is just incredible.
Awesome. What are some of the other things volunteers do at the organization?
We have volunteers that will drive our clients. We have a group of students at IB that volunteer and help our older blind clients with their cell phones.
Sure.
So we take volunteers of all ages, and you don't have to be computer savvy or anything to help. Just being able to help them fill out an application to apply for community transportation. All of these things, it takes time and small staffs, and we definitely depend on our volunteers.
Awesome. Okay. Well, thanks again for being here. This has been some great information about Independence for the
Absolutely.
Blind.
Thank you.
Next, we'll be talking about ways to make your home safer to prevent falls. Stay with us.
Over 2 decades ago, TLC Caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics. From a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC Caregivers.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
They call me Prince like I'm royalty or something. But the places I've lived ain't no palaces. So I don't need grilled salmon or a new scratching post. Just give me a cardboard box and a can of tuna and we're good. You can even change my name. I'm cool being the kitty formerly known as Prince.
For older adults, a fall in the home can be much more than a bump or bruise. It can lead to complications and a downturn in health and well-being. Falling is not a normal part of aging, and preventative measures such as certain exercise and reducing fall hazards in the home can make a huge difference in reducing the risk. Here to talk to us more about this is Corey Benici and Heather Hanna with Solaris Healthcare. Thanks for being here, y'all.
Thank you.
So first, tell me about Solaris and each of your role there.
So I'm Corey Benici, I'm the administrator. We are a 180-bed skilled nursing and rehabilitation facility. We focus on rehab, long-term care, hospice services. If somebody breaks a hip and needs rehab, they can come to us. COVID recovery, heart attack, things like that. We focus on everything along those lines. What I think separates Solaris and what Heather and myself, what we love about what we do is the culture of Solaris. We're one of the only facilities in the area who, through COVID and everything else, never utilized agency services. Some of our staff have been there 10, 20, 30 years, all the way from our dietary department to our nurses, skilled nursing assistants, and everything along those lines. So we really focus on customer service and communication, and I think that brings a culture that people love working there, but also can rehab and, for some of the residents, live the rest of their lives with us.
Gotcha. Okay.
I am the director of nursing, so I am in charge of oversight of the nursing department and all the day-to-day functioning of the facility when it comes to patient and resident care in our building, overseeing the rehabilitation of our residents as well as long-term care of our residents.
Okay. So tell us why fall prevention is so important for seniors.
Fall prevention is hugely important because a fall can be devastating. It can be life-changing. And when we're talking about our older population, one of the biggest things that we want to keep in mind is quality of life. And when you look at having a major incident like a fall, that has the ability to change everything in a devastating way. So loss of independence, loss of function, all those things can occur as a result of a fall. So it's hugely important to reduce and minimize the risks for fall, as well as reduce and minimize the risk for injury should falls occur. Falls are very common in the geriatric population because, as you get older, your body doesn't function like it used to, but it's a very difficult thing to give up that independence. And nobody wants to be, no one has to depend on their kids or their grandkids to do things for them that they've done for years, or any family member for that matter.
Right. But what are some common hazards in the home that aging adults may not be aware of?
Some of the biggest problems in the homes are, of course, rugs pose a huge trip hazard. Cords that are unsecured that are across the floor. So if there's lamps that are sitting on light tables or on side tables, if the cord goes across the floor, it's very easy to trip over that. Big areas where there's concern is anywhere there's water causes slip hazards. So you really want to look at the showers and the bathtubs. Grab bars are readily available now. Lowe's, Home Depot, different places like that, Amazon. You can order those offline. They're very easily installed, and making sure that they're accessible when you're entering and exiting the shower. Another big issue is a lot of times seniors will not ask for assistance, so they wind up do what's called furniture walking. So they're holding on to furniture that may or may not be stable in order to get through the home. So it's those are some big hazards, and keeping pathways, clear so that you can get through easily.
Yeah, sure. If an older adult themselves is concerned about their own risk, or a caregiver is concerned about a loved one's risk of falling, what can they do to help safeguard the home?
Safeguarding the home, they want to make sure that you're speaking with your family member and, first of all, gaining their acceptance of your assistance. Because if you go into the home and you move, I don't want anybody moving my stuff. Mm-hmm. So if you go into the home and you're moving things around, it has to be accessible still for them. They need to know where their items are. So you really need to have that discussion. I'm concerned about you. Let's move this rug. Let's move this table. Moving things around. Bigger things you can do if you're seeing changes is speak with your physician. There's home health services that are available. You don't have to have the big fall to get those services. If you're seeing problems with balance, gait difficulty, gait disturbances, have that conversation, have home health come out and talk with them and see what they can do. And another big barrier sometimes is the adaptive, equipment. We don't want to walk around with a walker. We don't want to walk around with a cane. Mm-hmm. So if you have people that have issues with that in the home, there's all kinds of duct tape and different kinds of things that you can purchase to actually kind of fancy up the adaptive device. So that way, if we can encourage compliance with using devices, it's going to end much better. Yeah.
And you mentioned some of these, but what are some of the preventative measures some older adults can take to mitigate falls?
One of the biggest things is going to be staying active and moving around, staying functional, being, involved where you can, getting involved with senior activities, taking a walk to the mailbox, walking the dog, different things like that, just staying as active as you possibly can. That's really one of the biggest things, because once you start to lose that activity level, weakness is pretty rapidly behind that. And then you can develop issues with just your gait pattern. So we really, really want to stay active as much as we can.
Are there particular exercises or types of exercise that older adults can engage in, or is it more that just that general staying physically active is more important?
It's really, it's going to be based on what the problems are, but really and truly, the bottom line is the more active you can stay, the better you're going to be.
Mhm.
So it doesn't have to be, I don't want people to think that there has to be a specific exercise that they have to do or attend a specific class. Just walking and getting out is going to be very beneficial. And making sure, if you see somebody with the shuffling gait, little reminders, pick your foot up. And that's when it's really time to talk with the physician and look at bringing in home health. And then they can take that extra step within the home and develop exercise programs that are going to be beneficial to that person, but are also going to be easily accessible within the home.
Right. So you don't have to become like a master of yoga or something to
Absolutely
improve
not.
your balance.
Absolutely not.
Gotcha. So if a senior does fall, what steps should they take, and what if they fall and they can't access a phone or are hurt?
Again, a big thing is trust. A lot of seniors don't want to say that they fell. They don't want to say that they're having issues, and that possibly leading to a loss of independence. So it's really important that you develop that relationship and that they understand that they need to talk to you and they need to tell you those kind of things are occurring in the home so that you can get more assistance. And there's ton of stuff out there now. There's all the way from cameras that you can put in the home, life alerts. You really need to look at developing a safety plan. So, I'm going to call mom every night at 5:00. And if mom doesn't answer, I know that I need to run over and check on mom, or speaking with the neighbors so that if there's more eyes going on, on that person. Yeah.
Well, thank you so much. This is great information. Thank
Absolutely.
you both for being here.
Thank you for having us.
And thank you for watching. Until next time, enjoy life. You've earned it.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.